I'm Bentley Graves. I'm the Director of Healthcare and Transportation Policy here at the Chamber. Just wanted to give you an update on a couple of issues we're working on at the Capitol. First, on the transportation side, you probably heard a lot about the MNLARS mess that has taken over the Capitol and a debate about transportation generally. That has to do with the fact that the state was to roll out a new system for processing registration and titles. Over a 10-year period, they developed a system and it was supposed to go live this year and didn't go well at all. And so the legislature is trying to figure out what to do next with that and may cost many millions more dollars. But in the meantime, Minnesotans are having a tough time getting their tabs and their titles. So we're watching that. But more importantly, this week, on Wednesday, last week marked Transportation Day at the Capitol, where hundreds of transportation advocates came to the Capitol, both to thank the legislature for the historic investment that they made last year in transportation, and also to ask them to build on that. And in doing so, ask the legislature to put on the ballot for this fall a constitutional amendment to constitutionally dedicate all of the sales tax and auto parts dollars to transportation. So last year's bill, the legislature directed about half those dollars for transportation. We, along with our allies in labor and in the transportation industry, are asking the legislature this year to go back and again set this up for voters in the fall as a constitutional amendment to permanently dedicate all those dollars for transportation, so we know that they're there year in, year out, and so that we can continue to do more projects around the state. In addition to that, the governor this last week set up a new task force on autonomous vehicles to help the legislature sort through what sorts of things we can do in Minnesota to set the stage for the development and deployment of this technology, make sure that we're a hospitable environment for this technology as it rolls out. So we're eagerly anticipating the work of that task force through the spring and the fall. And we'll look forward to the work their work product to set up this conversation for the legislature to ensure that, again, that we in Minnesota are a hospitable environment for this technology. On the healthcare side, we heard for the first time one of the Chamber's top legislative priorities in the House this last week. House File 3312, Senate File 2975 was introduced to bring Minnesota's Health Records Act law in line with HIPAA. Minnesota is one of two states that adds burdensome and costly requirements around consent on top of the already stringent HIPAA federal rules around when doctors can share information to coordinate care for their patients. Data from one study indicates that the passage of this legislation would help take out more than $100 million of costs in just our emergency room care alone across the state. That number would grow once you add in care given in the hospital or in clinics. So we're very excited about the momentum and the push for that legislation. We're working on that with our hospital members and our health insurance members and frankly everybody involved in the healthcare stakeholder community. We're also continuing to work on a couple small pieces of legislation on increasing price transparency and also looking at setting up an independent health policy commission here in Minnesota to help the legislature bend the cost curve over the long term, both in our public programs and the commercial market. And we'll expect legislation introduced soon on both those fronts.